Tennis elbow or lateral epicondylitis is the most common condition that leads to pain or problems about the elbow. It occurs in men more than women, usually in their middle age. We believe it represents pain from the origin of the forearm muscles where they attach at the elbow, and the tendon-bone junction leads to pain. It can occur from an injury, it can occur from heavy activity such as shoveling snow, and it can come out of nowhere. In fact, the majority of cases have no identifiable cause. They're termed idiopathic. Once you have tennis elbow, you get pain with any gripping or lifting activities. Anything that puts stress on the muscle, leading to stress on the tendon-bone attachment, can lead to sharp pain on the outside of your elbow. Well, the good news is that tennis elbow is what is termed self-limiting in the vast majority of cases. The problem is that it can take a very long time for tennis elbow symptoms to resolve. 6 or 9 months of symptoms is not uncommon. That does not mean you'll be terribly in pain for 6 or 9 months, but for the condition to completely resolve, it can take many months. We do educate patients. There are soft supports or straps or sleeves for the elbow to make the symptoms better during the day. We encourage high repetition, low resistance exercises. We encourage stretching modalities. We encourage patients to try to continue to have some activity, continue within the limits of their discomfort. We work in conjunction often with occupational or hand therapists, and the therapist can educate the patient about the condition. They can give them the appropriate home modalities to do, the stretching, the exercise program. They can guide them through, and they can help them build strength and endurance during the condition as well as after the condition, whether it clears on its own or whether it requires surgery. There is a subset of patients that do not improve with our conservative measures and with time. And most of the surgical procedures involve a release of that tendon-bone attachment to try to remove the pain. There's no functional limitation or downside of releasing the tendon, just we do it to try to relieve symptoms. The operation can be done through a traditional open approach. There are more now minimally invasive arthroscopic treatments in which we place a camera in the elbow and release the tendon from the undersurface. But the operation can be done by what's called a regional block, numbing up the arm. It does not require general anesthesia typically. It's done as an outpatient, and within a week or two you should be able to start rehabilitation and moving your arm and using it more. Well, in individuals that get better conservatively, meaning on their own, they go back to a normal function, meaning there should be no long-term residual symptoms. The symptoms go away. And what's interesting about lateral epicondylitis or tennis elbow, once the symptoms resolve, they typically don't recur. So it's almost a rite of passage. Once you've had it, you won't have it again. If you undergo surgery and you're one of the few people who don't get better on their own, majority do improve. It can take time, even after surgery, for patients to improve, and some still have some low-grade residual symptoms. So it's not absolutely always perfect after surgery, but it is much better.